I know this is getting long, but I just wanted to just quickly cover a few things. And we know vaccines work, but boosters are necessary, and they're critically necessary. And obviously, we need vaccines for children, and we know UK is not vaccinating nearly enough for, as you know, the JCVI didn't even approve vaccines for teenagers 12 to 16 until recently. And now they're only approving one shot. Meanwhile, the FDA is moving to 5 to 11 shots. The approval's going to come on November 3rd evening, and it'll be rolled out November 4th. But all this is, we need to basically not just waive the patents, we need to break the patents and directly demand for tech transfers. And if they don't demand it, we should in many ways threaten to either sue them for it or directly just crack the formula. And because that's what WHO is actually is working on. They funded an initiative in South Africa to directly crack the Moderna vaccine patent and to crack their formula to develop their own. And so I think this is really critical, but this should not be a first world country versus developing world. We should roll out more of this. And there are more vaccines in the horizon, and there are more that can be approved in the near future. But I think these are issues that we really, really need to tackle on a global scale. And obviously, a lot of you already recognize this, but I think in many ways, the social justice aspect of all this, and of course, the social justice around many other things, from testing and all the other precautionary measures, because who is bearing the burden of whenever you say you go out and work? It's blue collar workers, it's the laborers, it's oftentimes the white collar workers are not the ones who are suffering the most. And there's so much injustice around this. I think public health, the moral backbone of public health, has been completely broken by the politics. And in many ways, sometimes it's convenient to say don't get political. And I understand why you say that, and why many people say that. But at the same time, public health is policy. Policy is politics. You cannot disentangle the very nature of these. And that's why, in many ways, scientists and us advocates can't just advocate from oh, please, mister, can I have more? We can't have the begging aspect of scientists and other advocates. We have to wield political power, or we have to know how to build the political advocacy and the movement necessary to enact these social justice. So Greta Thunberg is not an elected member of any government body, but she knows how to command attention and command global action. And I think we need to take that kind of approach in terms of advocacy, not just, scientists would like to kindly request, or our studies are saying that this is what the science says. No, clearly there are those who are ignoring. There's obviously ignorance of, say, airborne transmission. And then there's willful ignorance of airborne transmission. And because it's an inconvenient truth, as we know, just like climate change is an inconvenient truth. So I think as public health leaders, we can't just be sitting back as scientists, hoping to publish into ether and some public policy person uses our scientifically recommended advice, nor just beg and write a petition or write an angry op-ed letter. I think those days are behind us, because we clearly know that the political powers that be that want to reopen, let it spread, let it rip, mass infection, live with the virus kind of approach. Clearly, they do not care about all the scientific rationale whatsoever, and they clearly don't care about op-eds or petitions.
Well, from that
And
standpoint, let's since you've raised it, and I think it is, not the 800, but the the massive elephant in the room.
yeah,
When one takes the science, we had something of a discussion previously about this. When the evidence scientifically is overwhelming. I don't think I exaggerated at the beginning of the program when I said that it is known what is necessary to end the pandemic. Most basically, one has to cut off the path of transmission from the virus to humans. We're dealing, as we have heard, with a virus which spreads in aerosols, which means they are ubiquitous. They are so minute in size, they can't be swatted away, or they're not big droplets, which, someone sneezes in your face. This is something which is present everywhere. That being the case, and I think you have some knowledge of this, isn't it the fact that one has to come to grips with the reality that the political forces, and the political forces don't exist in the abstract, they represent economic interests. Talk about pharmaceuticals as a profit industry. The greatest obstacle to implementing a policy which is effective today is economic interests, capitalist interests, which oppose and will not accept the subordination of profit motivation to human life. I mean, isn't that an essential takeaway one has to confront?
That is what we have to fight for, that, human lives should not take a back seat behind capitalist interests. Now, obviously, money makes the world go round, including the world of nonprofits, WHO, international agencies. But, many ways we have to make certain leaders, held accountable. And obviously, in certain ways, the Brazilian Senate holding Bolsonaro accountable for mass homicide is a good step, although he's probably not going to be convicted in the Brazilian lower house. But I think in terms of public endangerment, the willful public endangerment from either withholding vaccines, from let it rip kind of policies, from airborne denial kind of things, whenever the science was already clear. I think all that is so telling of what we truly need to do next.
Let me ask you, and then I'm going to ask direct this question to Dr. Gasparovich, who has a contribution she's going to make. But very briefly, and I'm getting many questions coming into me, which go around the following. If the present course continues without a change, I've already described, just went through the statistics of 2021, actually 2020, 2 million dead in 2020, 3 million dead in 2021. Where do you see this going in the next 3 to 6 months without a profound and dramatic change in policy? What will we be talking about in 6 months' time on a world scale?
On the world scale, we'll still be counting bodies in 6 months' time. The excess death numbers will pile up even more. We're going to have a really bad winter in the Northern Hemisphere. The winter is coming. We know that there's going to be another wave. You're seeing it in Eastern Europe. You're seeing it right now in the UK. UK hospitalization rates are soaring once again. And, UK doesn't even have boosters rolled out yet. And it's
Eric,
in most
countries, in many ways,
they're waning. Many countries were vaccinated later than Israel and the US. And Israel saw the waning early. So in many ways, the waning is going to kick in, and potentially Delta Plus and other things will kick in. And the winter indoor nature transmission will further accelerate super spreading. So we're going to have a really bad winter. So in 3 months, 6 months, we're still going to be really counting, oh my God, how is this COVID-19 spilling into 2022? And that's the reality. It will keep spilling over until we really, really come to grips that, I think eventually the governments will realize that keeping this pandemic rolling is going to have catastrophic outcomes. And it's kind of like, opening Jurassic Park. Oh, but there's one velociraptor still rumbling around. Oh, opening a zoo. Oh, but there's one rattlesnake lion on the loose in your zoo. That true economic recovery will not come until the pandemic is controlled enough that people believe that they're safe, that their kids are not sitting ducks. And truly, when that reckoning day comes, and that day will come, the reality will be who caused all these math deaths in publicly endangered